Manalisa C. Domingo, student nurse from the Baisia University of Science and Technology, and I'm going to perform normal delivery. And for the assessment, we need to assess the following. Ensure the privacy and dignity of the woman and make her feel comfortable. A male doctor needs a female assistant while performing the examination. Ask her if she understood what is going to be done, and ask for her permission before undertaking the examination. All the equipment, medicines, and disposables should be made ready before the pregnant woman brought into the delivery room. The woman is to be moved to the labor table in the active stage of labor. Unnecessary pushing in between contraction should be avoided. Ensure the woman is hydrated and the bladder is empty before encouraging the woman to push. All the neonatal equipment for essential newborn care and resuscitation should be pre-checked and kept ready until the pregnant woman is brought in. The room temperature should be maintained at the range of 26 to 28 degrees Celsius in the labor room, and the chilly areas will need heaters during winter. Provide emotional support and reassurance as feasible, and encourage the presence of a birth companion. And for the planning, prepare all the equipments and materials needed. Kelly pad, drainage pail, sterile OB pack, drape towels with or without instruments, sterile gloves, normal delivery sets, sterile pads, suction bulb, 2 straight forceps, 1 surgical scissors, placental bowl, syringe, hypodermic needle, aspirating gauge, injecting gauge, needle holder, chromic, thumb forceps, and tissue forceps. For implementation, change into DR suit. Put on personal protective attire. Wear goggles, mask, cap, shoe covers, and plastic apron. Palpate the suprapubic region to ensure that the client's bladder is not full. If it is full, encourage her to empty bladder or catheterize. Wash hands. Wear sterile gloves. steps. Talk to the woman and encourage her to take breaths through her mouth after every contraction. When the head is visible, encourage her to bear down for contraction. Support the perineum with one hand using a clean pad and control the birth head with the fingers of the another hand to maintain flexion, allowing natural stretching of the perineal tissue to prevent tears. Feel around the baby's neck. Feel around for the baby's neck, for the cord, and respond appropriately if the cord is present. Allow the baby's head to turn spontaneously. Then with the hands on the either side of the baby's head, deliver the anterior shoulder by gently moving the head little downward, which allows the shoulder to drop down the symphysis pubis. When the axillary faces of the anterior shoulder is in, deliver the posterior shoulder, lifting the baby upwards toward the mother's abdomen. Support the rest of the baby's body with one hand as it slides down and says, "Baby out, 9:30 a.m. female." Show the baby to the mother and place the baby on the mother's abdomen over a clean, dry, warm towel. In a prone position with the head on the side. Quickly dry the baby with a warm towel. Discard the wet towel. Wrap the baby loosely into the second pre-warm dry towel. And delay cord clamping for 1 to 3 minutes if the baby is crying or breathing wet. Palpate the mother's abdomen to rule out an additional baby or babies and proceed with an active management of the third stage and essential newborn care. And then look for any vaginal tears. If present, assess the degree of tear and manage accordingly. For evaluation, maintain the aseptic technique throughout the procedure. Cleaning of the labor table should be done immediately after the transfer of the mother to the postnatal or observation ward. And for the documentation, do the charting.